Dear listeners, today we will discuss about extent of prevalence of substance abuse and trafficking in India. Here we will get acquainted with different groups of people who abuse drugs. Drug abuse has affected various classes of people differently according to their ethnic groups, occupation, age, sex, etc. After listening to this, we will be able to distinguish how drug abuse has influenced various classes and C groups, and we will be able to identify the extent and areas of drug trafficking, and we'll be able to evaluate the consequences of drug trafficking. It is our experience that an epidemic or a disease does not affect all the people of a region equally. For example, malaria and TB may affect poor sections of the people more. Similarly, heart disease affects men more than women. Likewise, substance abuse has affected the population of India in varying degrees. We find that there are more addicts among the youth and urban population. We also find that certain ethnic groups become more vulnerable to drug abuse than the others. Similarly, drug trafficking is prevalent in some areas more than others. To some extent, geographical and political reasons are behind such variations. This unit will describe and analyze in detail the phenomena of drug abuse, trafficking, and the various groups connected with it. Drug abuse as a social problem. Drug abuse as a social problem. A social problem is a pattern of behavior that constitutes a threat to society or to those groups and institutions of which society is composed. In other words, social problems arise due to the behavior of group of persons in the society. The behavior of this group of people in the society is not helpful for themselves or for the society as a whole. An earthquake or a flood is not a social problem, but crime, illiteracy, etc. are social problems. The difference is that one is man-made and the other is natural calamity. All the societies have rules and regulations that prohibit such actions as murder, rape, robbery, etc. These rules or norms help the society function smoothly and to progress. When groups of people go against these rules, it becomes impossible for other members of the society to live in peace. Since earliest times, herbs, roots, bark, and plants have been used to relieve pain and help control disease. In itself, the use of drugs does not constitute an evil. Drugs, properly administered, have been a medical blessing. During the past 2 decades, the use of illegal drugs has spread at an alarming rate and has reached every part of the globe. The drug abuse is a problem of the world society. Drug abuse is no longer considered a victimless crime. It is a crime that imposes a staggering burden on the people and the nations of the world. It is a burden no society can afford to carry. The illicit production, distribution, and consumption of drugs have intimidated and corrupted public servants and have even destabilized governments. The erratic ebb and flow and sheer volume of drug money have affected the money supply and exchange markets. UN Report 1992. Drug abuse is a global social problem. It is not confined to one nation or a continent. This is a social problem that breeds terrorism, black money, arms trade, and murder. Many of the victims are innocent civilians. The power of the groups trading in drugs and arms are such that they are able to bring down democratically elected governments. Such instances have happened in South America, Sicily, and Afghanistan. Drug trafficking. Drug trafficking is the illegal transport and sale of drugs from one part of the country to another or from one country to another. Widespread networks of interrelated groups exist which employ modern technology to produce and transport illicit drugs, carry on drug trade. They are armed both for protection and intimidation and can be very dangerous. Their methods are sophisticated and complex, involving a wide variety of drugs from many different sources throughout the world. This illicit traffic not only violates national drug laws and international conventions, but also involves many other criminal activities, including racketeering, conspiracy, bribery, and corruption of public officials, tax evasion, banking law violation, illegal money transfers, import-export violations, crime of violence, and terrorism. Why is there an increased drug trafficking in the world? There are many reasons for this. One reason is the growing demand for narcotic drugs. The second reason is that some drugs are naturally occurring and obtained from plants such as the opium poppy and the coca bush, while semi-synthetic drugs such as heroin and cocaine are produced in the chemical factories located in technologically advanced countries. A third reason is that some countries have very efficient control system, whereas some countries directly or indirectly encourage the production and the trafficking of illegal drugs. Most drug trafficking is carried out in secrecy. Drug industry is a multi-billion rupee business. It is estimated that the annual turnover of this industry is approximately 1600 billion rupees. Illicit trafficking is increasingly organized by persons or groups which finance and control operations, all without ever handling the drugs themselves. Often, it is the professional criminals who are the agents for drug trafficking. The criminals continue to operate in the field because of the tremendous profits. The drug trafficking groups are often known as the mafia. They have a very efficient network of production and distribution. They also study the market and peak demands areas and the drug of choice in a specific geographic location, while maintaining the flow of narcotics around the world. Relationship between drug abuse and trafficking. The simple rule of demand and supply operates in the area of drug abuse and trafficking as well. For an addict, the drug becomes an essential commodity. For essential commodity, the demand is inelastic. If the supply is reduced, the demand will not become less, but the price will go up. As we saw in the earlier chapters or audios, the addict will need more and more of the quantity of the drug to satisfy his or her craving. When the addict is not able to meet the expenses for the drug he or she requires from his or her own resources, the person will start trading illegal. Thus, the person becomes an addict as well as develops a link in the illegal trafficking system. The criminal gangs use children to sell drugs. As per law, children below 12 years cannot be convicted of any crime they commit. It is in Brazil that the phenomenon of street children has appeared in the largest proportions. They act as couriers of the traffic of illegal drugs and themselves become drug users. Some children are used in the neighborhood as drug couriers. They are known as aviozinos, the little airplanes. They earn a bit of money that allows them to contribute to their family's subsistence. From as young as 6 or 7 years old, drug becomes an important part of the lives of these children. Facts and figures related to drug. The United Nations Drug Control Program's Annual Report 1999 has given the facts and figures of the world, estimating the number of drug abusers and the kinds of drugs they use. For example, narcotics. There are 8 million estimated total abusers, and it corresponds to 0.14% of the world population. If we talk about cannabis, there are 141.2 million estimated total abusers, and it corresponds to 2.45% of world population. So there are total estimated 218.2 estimated abusers in millions, and it corresponds to 3.92% of world population. And this data has been taken from UNDCP ROSA 1999. It reveals that nearly 4 persons out of 100 persons in the world use one or another kind of drugs. This may not be the same in all the countries. Some countries have more addicts per 100 than other countries. Cannabis is the most abused drugs, followed by sedatives. Prevalence of drug abuse in India. Alcohol, cannabis, and opium are the traditional drugs abused in India. Studies conducted in all the 4 regions of the country showed a certain data. If we talk about, the survey was mainly conducted in the urban areas, therefore the results may not reflect the real picture of the country. As it is clear from the data, the northwestern region has more opium addicts and the northeastern region has more heroin addicts. Please clarify, as population is less and high percentage does not mean high numbers. The opium addicts are mainly the working classes, the heroin addicts of the northeast, and those in the cities who are mostly youth. The labor class as well as the working class use cannabis, but for different reasons. Okay, so drug use prevalence continues to be stable around the world. According to the 2015 World Drug Report of the United Nations Office on Drugs and Crime, UNODC, it is estimated that the total of 246 million people, slightly over 5% of those aged 15 to 64 years worldwide, used an illicit drug in 2013. Some 27 million people are problem drug users, almost half of whom are people who inject drugs, PWID. An estimated 1.65 million of people who inject drugs were living with HIV in 2013. Men are 3 times more likely than women to use cannabis, cocaine, and amphetamines, while women are more likely to misuse prescription opioids and tranquilizers. World Drug Report 2015. Production of illegal drugs. The production of opium in the world in 1996 was 3,900 tons. 80% of this amount is produced in the Golden Crescent and the Golden Triangle. The countries where opium poppy is grown are Afghanistan, Myanmar, northern Laos, and northern Thailand. 98% of the world's cocaine is produced in the South American countries of Peru, Colombia, and Bolivia. The estimated cocaine production in 1996 was about 1,000 tons. Social cost of drug abuse and trafficking. Although we will be discussing this in detail later, it is useful to note certain important points. Drug abuse involves a lot of hidden costs. There may not be many persons dying only due to drug overdose or alcoholism. The consequences of drug abuse are mentioned as health, family relationship, social relationship, crime, accidents. The first result of drug abuse is the loss of health. This affects not only the individual but the whole healthcare system. Due to widespread drug abuse, diseases like HIV/AIDS spread. This adversely affects the healthcare system in the society. Healthcare is very much the responsibility of the individual. Drug abuse is one case where the individual becomes absolutely lax about his own healthcare. Family is the basic cell of the society. Addiction disrupts family relationships. Family is also the factor that supports the emotional growth of the individual. Children growing up in families where there is drug abuse grow up as misfits both in the family as well as in the society. Disrupted family relationships negatively influence the harmony in the society. Addictions makes an individual isolated from the society. This is because addiction is seen by the society as something evil. The addict tries to hide his addictive habit from other members of the society for fear that they may not accept him as a sane person. The stigma attached to drug abuse forces the addict to go underground. Social isolation leads to crime. Organized gangs use the addict as a tool for their own criminal purposes. Addiction is the cause of many traffic and industrial accidents. Many work days are lost due to drug abuse. Drug abuse among different groups. Although drug abuse is a widespread problem, it does not affect all groups equally. There is a marked difference from region to region, from age group to age group, and from gender to gender. Drug abuse among the youth and street children. From the middle of the 1960s, drug abuse in schools, colleges, and universities has become a serious issue. The first study was reported in 1963 from Calcutta. Among 1,132 university students, the prevalence rate was 37.4%, tobacco 26%, amphetamine 11.45%. Later studies showed that drug abuse was more common among the male students. Single drug abuse was uncommon and students often used multiple drugs. Another study conducted from 1975 to 1978 among high school, which were English medium, students revealed that 34% of them used drugs. The abused drugs included alcohol, amphetamines, cannabis, LSD, tranquilizers, opium, pethidine, and barbiturates. Studies conducted in various parts of India from 1970 to 1986 showed that 10 to 15% of the students used alcohol sometimes in their lifetime. This comprised high school and college students. Tobacco was used by 8 to 15% of the students. 1 to 2.5% of the students had tried tranquilizers. Use of heroin was widely reported in India since 1986. Use of cannabis is increasing among the college students. 5.4% of the students interviewed reported to have tried cannabis sometime during their college days. India has perhaps the largest number of street children. Due to poverty in the villages, children move to the cities in search of work. Rag picking, shoe shining, employment in hotels and small industries give them enough to survive. When honest means are not available, they take to petty crimes like pickpocketing, theft, etc. These children come under the influence of drugs due to peer pressure. Many of them work for long hours in monotonous occupations. Drug helps them to handle their physical and emotional pain. They start their tobacco smoking, move on to solvents, brown sugar, and other sedatives. By the time they are 10 years old, they become dependent on tobacco and alcohol. A survey in the Delhi slums showed that 75% of the 16 years old boys use alcohol regularly. In all, about 50% of them have experimented with the cannabis. Less than 10% reported to have used heroin. One reason for lower number of heroin users is the cost involved. Researchers done all over the world have revealed that comparatively lesser women take to drug abuse. Biologically, drugs act differently on women. As regards social aspects, it has been seen that society is less tolerant to drug use by women, more so in the traditional cultures of this region as in Asia. Even if it is existing, it is hidden and not reported. Drug-taking women are seen as doubly deviant. Female drug abusers have been reported from Goa and some industrial towns, say in 1991. It has been reported that in the northeastern state of India, about 7% of addicts were women. Among university students in Delhi, it was projected that women composed about 22% of drug abusers, Agarwal 1995. By and large, it has been projected that women use tranquilizers more than men. Social consequences of drug abuse are worse among women than men. Shouldering the responsibility of bringing up the children and taking up the role of caring, they lose their ability to perform their role satisfactorily. Other family members often lock them up, reduce their pocket money, and eventually throw the women out of home. Most have to support their habit by borrowing money and misappropriating household income. Sometimes Drug use among women is associated with drug trafficking, peddling, and other illegal occupations like prostitution. This profession makes them easy prey to HIV infection. It has been also seen that many affected women do not seek treatment as there are no specialized treatment centers for women. Prevalence of drug abuse among the prisoners. Our prisons do not have any system of taking care of drug addicts. There is no national data available on the extent of use of drugs in the prisons. The number of arrests made in connection with drug abuse is on the rise in the country. Most of the arrested addicts somehow manage to continue their drug habit in the prisons. In some other cases, drug habits are picked up in the prisons. This is due to circumstances and to avoid the boredom in the prisons. There is hardly any separation of this kind of prisoners in the jails. Children who are not addicts but are arrested for peddling are jailed along with other criminals. Reports have mentioned that about 15 addicts are admitted to Tihar jail in Delhi daily. Prior to 1993, no special program was there for treatment and rehabilitation of drug addicts in Tihar jail. Today, there are 5 full-fledged centers satisfactorily functioning in the jail. Prevalence of drug abuse among tribal communities. There are estimated 300 million indigenous people worldwide, living in over 70 countries. They are called indigenous or aboriginal peoples because they were living on their lands before settlers came from elsewhere. There is great cultural, ethnic, linguistic, and religious diversity among them, ranging from hunters and gatherers living in inaccessible rainforests to business leaders in the world's famous financial centers. Nevertheless, most indigenous groups have sharing a common heritage in their use of psychotropic substances. Over the centuries, they have learnt about the mind-altering properties of many of the naturally occurring substances around them. They are often highly valued for their medicinal and nutritional properties and for their use in religious practices. Hallucinogens, including certain types of mushrooms and the cactus peyote, have been widely used among communities in Central and South America to access the spirit world and for initiation ceremonies. In Asia, opium has a long history of use for relaxation and as medicine to relieve chronic pain and gastrointestinal problems. In Africa, the use of cannabis fermented beverages is common and forms part of the normal lives of some indigenous people. Within cultures, strict taboos and restrictions have helped to regulate the use of traditional psychotropic substances, whereas many communities have maintained their traditional practices because of their isolation from the rest of the world. Many others have seen their cultures eroded in the face of assimilation and the integration policies of dominant ethnic groups. Tribal communities seem to have become more vulnerable to drug abuse. This is seen from the fact that the highest incidence of drug abuse is reported from the states of Nagaland, Mizoram, and Manipur. Moreover, the various Adivasi tribal communities of central India too have a very high rate of alcoholism usage among their members. The reasons are several. Tribal communities provide greater freedom for their young ones. The tribal communities are in a period of transition, having been hitherto isolated from the rest of the country. With increased communication and transport facilities, they are suddenly exposed to new value system. Their own value system and social controls are no more effective to keep the society together. The most affected tribal communities are in the northeastern states. Most of them are bordering Myanmar, the drug-producing region. Many tribal communities of central India are also connected to the opium-producing areas of Madhya Pradesh. There is a perceptible rise in the nature of addicts in the tribal communities of northeast India. Nearness to the drug-producing areas, as well as the sudden exposure to alien cultures and values, make the problem serious. Added to it is the rise of terrorism, where drug trafficking and arms trade go hand in hand. However, in the tribal communities, the use of alcohol as daily food item is a common practice. There are no legal restrictions on the production and consumption of alcohol. The kind of alcohol beverages earlier used by the tribal societies were not distilled. Most of the alcoholic toxins are absorbed through the intestinal tract. When a person takes alcohol and engages in hard work, it helps him to burn up the calories. With the advent of market economy, many youth as well as elders are able to live idle. This too has contributed to the growth of addiction among the upper strata of the tribal society. So we discussed about drug abuse and trafficking of drugs go together. Where there is demand for drugs, there will be also the supply of the drugs. Drug abuse and drug trafficking are illegal activities. At the same time, they are also social problems. We also discussed how drugs abuse is a social problem and what drug trafficking is and why there is drug trafficking and various factors that influence drug trafficking. We have presented a table and also discussed extent of drug abuse in the world and in India. Different ethnic, age and gender groups have different problems when they begin to take drugs. And here we had a detailed picture of drug abuse and drug trafficking seen in India and in the world.